So we are going to look at the program theory, and the program theory in the health programs. This theory, for it demonstrates the relationship between the mission, the goals, and the objectives, and also the activities in a given in a given program. So if I take an example of the logic model or the logical framework, it is a graphic or pictorial model. So these are the logic model or the logical framework. It helps us to show us the relationship or the flow of the activities. We start with the resources. All these resources can be the inputs. You see in the arrow, it takes us to the program activities. Then program activities, we go to the outputs. Then from the outputs, it takes us to the what? To the outcomes. And these outcomes, it takes us to the impact. So uh, the common scenario here, if if we have a problem and we want to analyze a problem, we first analyze we do a problem analysis. Then from a problem analysis, we come up with our objectives. So we do analyze the objectives. Then after analyzing the objectives, then that's where we continue and go and we come up with something called a logic or a log frame. So we have the direction. This one, I can call it the change theory, where we start from the resources. Those are the inputs. Then from the inputs, we go to the activities. So it is the inputs, then we have activities, then we have outputs. Uh, an outcome is as a result of an output, and from an outcome we have impact. So outcome, they are the immediate effects of the outputs. Then also we have the impact. Those are sometimes they are called the long-term effects of an output. So when you are designing a logic model, we always have a goal. And this goal, now for example here, it was to improve the resilience of and decrease the health disparities among senior citizens aged 55 to 75 who participate in the what? In the program. This can be practically drawn if we have a problem which you've analyzed. Now I think here the problem, it was the decreased health disparities. I think next in our next meeting, we shall see how we can come up with something like this, a logic model, so that you can understand it well. But for now, you can see that under the resources, we have the funding, the older volunteers. Then for the activities, we have health promotion materials. So the output can be full of trained volunteers, volunteer champions. Then the outcome, the short-term outcomes, it is improved knowledge, attitude, and health behaviors of program participants. Then for the intermediate, So we have the intermediate, like improved health protection behaviors. Then long term, this one is the impact. Improved resilience of older participants. Then decreased health disparities. Next time I think we shall come up with a problem, then we try to analyze and we try to generate ours practically so that everyone can understand it well. But for now, we just appreciate this one. But now our next meeting, I think we need to come up with the one. So these are some of the components which I have tried to explain in the logic model. Then some of the advantages of the logic model, that it provides information on the crucial elements of the program. So as the information flows, starting from the inputs to the long-term impacts, so it shows how information flows. Then also the relationships between the impact, the activities, the outcome, and the output. Then it is easily understood by stakeholders. Remember, it is a flow. The way it flows. You know, when you are coming up with a logic model, you don't just sit down and just draft the activities you need to appear on the logic what on the logic model. That logic model, the reason why it is called logic, there is a chronological flow of information, and this information, and most times we generate it from, if we do the objective analysis, that's how we get the information. So you can't say from activities and you jump to the long-term impact. It has to start from the inputs, you go to the activities, like that. It is chronological. So you can use it to manage a project. Then we have something on evaluation questions. For evaluation questions, they say stakeholders have to be involved, and the evaluation question determine the nature of research design and collection methods. Now, when they say that the stakeholders have to be involved, stakeholder involvement is crucial always. So here, some of the stakeholders, if you have like a health project or a program, some of the stakeholders, we can have the health workers and also the patients. Then also I think we can also have the health officials, let me say from the Ministry of Health. And remember, these stakeholders, their participation ensures that evaluation questions reflect the real health needs and practical realities of the service delivery. For example, maybe if you have a maternal health program, these stakeholders sometimes, or they can identify questions such as the mothers receive the recommended number of ANC visits. So that is a question which can be identified by the by the stakeholders. Then sorry. Then also these are the evaluation questions. They determine the nature of the research design and the data collection methods. Now, for example, if you have a health program, the type of evaluation question, it directly shapes the research design, and also the sampling, the data collection methods, the sampling and the data collection methods used. So That's why they say that the evaluation question determine the nature of the research design and the data collection methods. So some of the features of effective evaluation questions: one, they have to be clear and specific. The questions should be precise and easy to understand, and it should also focus on the particular aspect of the what of the program, that is being clear and what and specific. Then it should be linked to the program. So when they say it should be linked to the program, the question must directly relate to the program's objectives, activities, and what and the outcome. So it should help us. It should help the assessment on how well the program is performing, or what what impact is it having. That's that's how it can be linked to the program. Then also they said linked to the indicators. Remember, we have a number of indicators which can be used to assess the performance, starting from the input indicators, the activities, the output, sustainability. We have even context. We have a number of indicators. So an indicator can be a tool which can be used to assess the performance of a program or a project. So when they say that it should be linked to the indicators, here effective evaluation questions are connected to what? To measurable indicators that show the progress or the results. So these indicators, they provide the data used to answer the questions. So that's why the evaluation questions should be linked to the what? To the indicators. Then we have incorporate needs of health, incorporate needs of stakeholders. So here the questions should reflect the concerns and priorities of the what? Of the key stakeholders. Remember last time we discussed that in any project or a program, we have a number of stakeholders. We have those ones who are the key. Then we have those ones who have low interest but high power. Then we have those ones who have high interest and high power. So they are categorized. So here, the questions should reflect the concerns and the priorities of the key stakeholders. So this ensures that the evaluation is useful and what? And relevant. So that's why you should incorporate the needs of the what? Of the stakeholders. Because without the stakeholders, the project cannot stand. We need to incorporate their needs into the what? The evaluation questions. Then can be based on the logic model. Now, these evaluation questions, they should align with the logic model, linking inputs to activities, activities to outputs, then outputs to outcomes, and the impact. That chain, the way you see it. So we have the sources of evaluation what? Questions. So these sources, the sources of the evaluation questions, they can be from the logic model, the stakeholders, then also the previous evaluation. What were the results of the previous evaluation? Then for the stakeholders, that one we've seen, and the logic model as well. Then also the evaluation team, the external evaluators who are involved in the evaluation. They can also come up with what? evaluation questions during an evaluation of the health project. So these are some of the questions from the logic model. That one you checked it out. So we have a nominal technique. So nominal technique, this technique can be used in the selecting these evaluation questions. So here in the nominal technique, individuals can generate ideas independently, then share and rank them collectively to sometimes to identify priorities and or solutions. This technique, it is participatory. Everyone is involved. So you gather different teams. So different teams they are given a concern to address. So every group they sit and brainstorm. So they come up with a list of can I say the answer? They can come up with a list of what they understand about what they are given. So each group, after doing that, they come up together. So after generating those ideas, so afterwards they share. After sharing, they will discuss. Then they will start ranking. So they will start ranking those ideas generated, and they will identify the priorities or a solution. Like the way how you're seeing this nominal group technique. I think the first one is generating ideas. So here the participants, they are given time to reflect on the summary of the previous findings. So they make their own notes. So after they record those ideas, they can use a material like a flip chart. Then after they discuss the ideas, after discussing the ideas, then they will rank the ideas. So for each exemplarist, participants individually rank on the paper order of the importance of these exemplars. So rank order scores are then calculated. Then here we go to the program indicators. So qualitative or quantitative variables that allow the changes that occur due to intervention to be measured. So they are saying these program indicators, they should be veritable, then document all day-to-day activities. Those are the minutes, the expenditure, then also the work plan. So what do they mean when they say that it should be veritable? So here the program indicator is verifiable when it can be measured and confirmed using reliable data sources or evidence. So that's why they are saying that it should be veritable. Then here, measuring concepts and construct. So construct is an idea or theory containing various conceptual elements, typically one considered to be subjective and not based on on the empirical evidence. So measuring construct, it can happen at the individual level. There we look at the knowledge, attitude, practices. Then interpersonal level, that is peer or family influences. Then also we have the community level, jobs and transportation, and their influence on the utilization. Then organization level, Here, organization norms, practices, and services that influence the individual's ability to assess service within the institution. So, evaluation research design. We have a number of research designs. We have observation, those ones which are under observation or experimental studies. Then control and comparison populations testing for causation. Then you have quasi experimental evaluation design. So when they talk about the research design, we have a number of research designs. I think here I want everyone to go and look at the various research designs which we have. Those ones under observational, the control, and comparison. Here an example of observational can give you an example of the cross-sectional studies where data can be collected once in a lifetime. So you go and read about that, you discover more about that, because I know you at the time you do research, you need this knowledge. You need one of the research designs to employ when you're doing your research. Then you have the control and the comparison population testing for what? For causation. Here you can look at there's a research design called case control, where you under case control you can have two study populations. You can have a group which is having a disease, then a group which doesn't have a disease. So the reason why it is called the control, for case control, for it we just look at what might have caused the disease. That's why they are saying testing for what? For causation. So you get one group which is healthy, then you get one group which has a disease. You may ask yourself, like if you have someone who has TB, then another person who doesn't have what? Who doesn't have TB. Then you have to trace the environment where this person who has TB stays in, the type of work he does. You understand? And also you compare it with the person who doesn't have what? A disease. So you'll be comparing, looking at the what? The reasons why this person got TB. So that is a what? A case control design. That's what you can use here. Then quasi experimental. There is a researcher design which called RCT, randomized and non-randomized control trials. So if an evaluation is not it is neither an RCT nor non-RCT. When I say RCT, that is a randomized control trial. So there you employ this. That is a quasi experimental evaluation design. You can read about that. You discover much about the different research designs we have and where they can be applied. You need that knowledge, so you can do more research about that. That was just a summary. What I've given was just a summary. So we have efficiency assessments. So these are undertaken when the outcomes are available and all benefits have to be converted to monetary value. So these efficiency assessments, they include, we have the cost benefit analysis, then the cost effectiveness analysis. So when they talk about the cost benefit analysis, here the CBA, cost based analysis, it compares the total monetary value of the benefits to the total costs of implementing a program. So the cost benefit analysis, it helps to determine whether the benefits outweigh the what? The costs. Here, an example which I can give, if you are evaluating whether the economic gains from, what example can I use? Let me say a malaria prevention program. So here you evaluate whether the economic gains from a malaria prevention program exceed the cost of distributing the malaria what? Nets. So you just compare the total monetary value of the benefits to the total cost of implementing the what? The program. Then the other one, which is cost effectiveness analysis. Here you just compare the cost of achieving a specific non-monetary outcome. For example, maybe some of the non-monetary outcome, like number of children who are vaccinated. So when we go to the data efficiency assessment, so this one, the cost effective analysis, for it can be, sometimes it can be helpful. It is difficult to assign monetary values to the what? To the outcomes. Maybe the example which I can talk about, you can say we can compare the total cost per life saved between different, let me say, HIV prevention strategies. So when you compare the cost per life saved between the two different HIV prevention strategies, so that is a cost-effective analysis. And then we have data for efficiency what? Assessment. So data for efficiency assessment, here we'll look at three things. That is administrative expenditure, the direct costs, then the unintended costs. Administrative expenditure, these are management costs incurred in running a what? A project or a program. So this data is sometimes it can help to determine how much of the total budget is spent on management versus the what? The direct service delivery. So it is administrative, the administrative activities. So the costs incurred in running the what? The program or a project. That is the administrative expenditure. Then for the direct costs, these can be expenses which are directly linked to the project or a program and the what? And the service delivery. Then unintended costs, since they are unintended, so they are unexpected or indirect costs that arise as a result of the program's what? Program's implementation. So we go to internal validity. So for internal validity, is the extent to which an effect is observed was caused by what? Systematically planned intervention, and does not occur if the intervention is what? Is absent. So in other words, for internal validity, it measures how sure we are that the intervention caused the what? The observed outcome. For example, here the example, like if a new, let me say, if a new, can say if a new nutrition program leads to improved child the for example, if there is a new government health campaign or disease outbreak, if it affects it could affect result what independently of the program. So if there is an external event which influences the outcome during what evaluation, so that is a history. Then instrumentation, and this usually happens when the changes in measurement tools or data collection methods when they occur during what the evaluation. Then maturation, these are just natural changes. They're just the natural changes that occur in what in participants. Then regression. For regression, it occurs when the groups are selected based on what extreme scores, and this can be very high or very low. And the scores, they naturally move towards the average over what over time, even without an intervention, like the statistical regression to the what to the mean. Then for selection, this usually manifests if there is a selection bias, where it arises when they exist between different groups. If different groups are being compared before the intervention begins, so that's where this selection bias sometimes manifests. Then the other one is statistical conclusion. So this one, for it relates to errors in data analysis. For example, let me say inappropriate statistical tests sometimes can also be visible in smaller sample sizes. Also, when you misinterpret the data and you come up with small sample sizes, so there statistical conclusion sometimes happens. Then for testing, here testing, if someone they are trying to, if they are doing an evaluation and they have come up with their tools, sometimes people are required to go to the field, so they pre-test, they cut out a pilot a pilot study, that one during the baseline surveys. So they do the testing. So here for the testing, it occurs when taking a pre-test influences the post test results, independent of the intervention. So all this information was explained. It is a matter of reading through, but it was provided. So that one, I think that one you'll read. So we have issues randomization cannot solve. That is the diffusion, compensatory equalization, and rivalry. So those were the issues that randomization cannot solve. So the first one, the one on the diffusion, this one occurs, let me say, when members of the control group are exposed to the intervention. So it reduces let me say, the observable differences between the two groups. That is the diffusion. Now, an example here which I can give, for example, if we have a health education program, the participants in the control group may learn hygiene practices from their friends in the intervention group. So for compensatory equalization, this happens when those responsible for delivering the programs intentionally or unintentionally provide the additional support to the control group to make them feel treated equally. Then the last one for rivalry, this sometimes it occurs when the control group works harder to compensate with the treatment group after realizing they are not receiving the same intervention. So even this information is being provided. So I think the last one, it was on the external. We saw the internal validity. So I think the last one was on the external, where they were saying that external validity is the extent to which an observed effect can be generalized to other times, settings, and the populations. So it can be achieved. So we have homogeneous population and large samples. So for homogeneous, this one can include participants with diverse characteristics like age, the gender, social economic status, then also location can also be among, and it helps to ensure that findings are applicable to a broader population, that is the heterogeneous. Then for this one, the large sample, larger samples increase the representativeness of a population, so it can make it easier to generate the results.